Hi, my name is Sonia McGowan, and today I will be presenting to you my PowerPoint on cultural diversity. The issues we'll be covering today: responding effectively to cultural aspects of patient and family care, minimizing language barriers, dealing with diversity issues among staff, minorities, and men in nursing. Cultural diversity. Hello, my name is Sonia McGowan, and I will be presenting my presentation on cultural diversity. We will be covering topics responding effectively to cultural aspects of patient care, minimizing language barriers, dealing with diversity issues among staff, and minorities and men in nursing. Cultural aspects of patient and family care. By the year 2020, it is projected that half of the country's children will belong to a minority group, according to the 2015 report from the U.S. Census Bureau. Numerous studies have shown the disparities that exist among minorities in regards to receiving quality health care. The average wait time for a kidney transplant for an African American is twice as long as that of a white patient. African American and Hispanic physicians are more likely than white physicians to practice in underserved communities and treat a larger minority group at low income. Dealing with diversity issues among staff. There are many statistics that paint a grim picture of the current state of our healthcare system as it relates to diversity. The first step in a resolution is for healthcare organizations to not only commit to a diverse staff, but to also invest in continual cultural education as well. The most effective healthcare professionals are the ones who make a point to ongoing learning and progress. Healthcare teams that lack diversity might only bring in only a certain patient base, for example, white patient base, and will have no understanding to certain genetic conditions that is geared towards a specific ethnicity. Approximately 9 out of 100 people have limited English language. All healthcare providers who get federal funds must provide equal access to services. Offering a qualified medical interpreter free of charge and having translated materials is a good way to overcome language barriers with patients. Train the staff to better serve the patients who have communication barriers. Use visuals such as pictures and graphs. Also make sure the written materials are culturally appropriate and written in plain language. Before the patient's visit, tell the medical interpreter what the visit is about and make sure they understand the information. During the visit, make sure the patient knows the interpreter's name and what they will do. Make sure the patient understands that the interpreter will not share their information. Make sure the patient is the one making decisions about their health care and understand the main points. Use teach-back methods to make sure the material presented is understood and have the patient repeat back to you what is said. In 2008, there were 3,063,163,000 registered nurses in the U.S. Only 6.6% were men and 16.8% were non-Caucasian. In 2010, about 11% students enrolled in nursing school were men, and 26.8% were a racial ethnic minority. Students show that male student nurses face additional obstacles and discrimination. These include lack of sufficient role models, unequal clinical opportunities and requirements, and lack of teaching strategies appropriate to male needs. Minority student nurses also face obstacles like classroom biases, hostile interpersonal climates, and isolation. Because nursing is predominantly female, male nurses must work even harder to prove they are just as competent as their female counterparts. Male nurses are expected to be physically stronger than female nurses and are often asked to assist with lifting heavy patients. A male nurse will prompt ridicule from others since nursing is not viewed as a respectable profession for men. Many male nurses experience anxiety and stress when dealing with a patient and their family, or even their own family, because of this stigma. These are some of the reasons why more men don't pursue a career in nursing. Nursing school faculty and nurses should be given the same opportunities to nursing male students when they precip them. Female student nurses should treat the male nurses with the same respect, especially in a clinical setting. Other healthcare professionals should make the effort to respect the decision males make to become nurses and help them grow in their profession. Friends and family should support and encourage their males in the nursing field to grow personally and professionally. Nursing schools, male student nurses, and male nurses should educate the public with school, career, and health fairs. The underrepresentation of ethnic minorities in the nursing workforce is significant. According to the findings from the 2008 National Sample of Survey of Registered Nurses, only 16.8% make up the nursing workforce. In addition, according to the AACN, in 2010, fewer than 12% of full-time nursing faculty were minorities. Minority nurses often share past experiences about racism and biases in their nursing education. Increasing minority faculty representation is crucial in making nursing a more diverse field. Increasing minority faculty representation is important in making nursing a more diverse profession. Nursing still lags behind other professions in terms of diversity, but it is distinctly placed to have a more dynamic role in a nation with continual increase in racial and ethnic diversity. In spite of these challenges, it is crucial the minority nurses consider a career in a faculty role lest we continue to be underrepresented with little voice for change. Cultural, racial, and ethnic demographics continue to change in the United States with minorities predicted to become the majority in 2043, according to the U.S. Census. Yet the nursing industry is still trying to mirror the changing face of its increasing diverse patient population. Although the RN workforce is more diverse than it was 10 years ago, the majority is still white, about 75%. So the U.S. still has a long way to go before its healthcare workforce represents a diverse population. According to the U.S. Agency for Healthcare and Research Quality, minority populations continue to experience disparities in the healthcare system, which includes not having access to quality healthcare, proper health education, and poor patient-provider communication. Fortunately, there are efforts underway to improve diversity within the healthcare system, state, federal, and nonprofit programs. In an effort to attract more minority students, many nursing schools have developed a range of initiatives to boost diversity in their programs, which includes adding cultural competency to the program, hiring minority faculty, launching minority student learning centers and campus resources. Including more diversity to nursing becomes a vital tool to address the disparities and improve patient care. These are just some of the ethnicity statistics on minorities in nursing. There are 9.9% of RNs who identify as Black or African American, 8.3% are Asian, 4.8% are Hispanic or Latino, 0.4% are American Indian or Alaskan Native, and 1.3% identify themselves as two or more races. This is the gender statistics. There are 9.1% of RNs who are men, and 7.6 of LPNs are men. This is the end of my presentation on cultural diversity. Thank you.